This is Wendy Johnson. She has been a patient member at Blue Upper Cervical Chiropractor for a little over 2 years, and she's going to tell you about her experience prior to upper cervical care and what she has experienced as a result of upper cervical care. Take it away.
Without warning or without precursor, my migraines started when I was a sophomore in high school, and they didn't start out small and work their way up. They were instantly screaming meanies, I call them, and I call them that because I did a lot of screaming and crying when they happened. It felt as if someone was stabbing me with an ice pick behind my eye, and along with that pain, there was pain in my jaw and my neck. 95% of the time it was on my right side, but every now and again it would go to my left side. But this is where the main gist of it was. This led to many, many different diagnoses. I was given cortisone shots in my face and in my neck. I had wisdom teeth pulled. I had CAT scans run and EEGs run. I even carted around an oxygen tank for a while because they said that I wasn't getting enough oxygen to my brain. I had been to other chiropractors to no avail. General practice chiropractors didn't really help me. Short of morphine, I had taken some pretty strong narcotics just to try and take the edge off. And my oldest daughter was nearly truant because I kept her home from school to watch her little sister because I wasn't able to. Are you going to edit this?
Go
Did
ahead.
that mess you up?
You're doing fine.
When I finally found a chiropractor that gave me some relief, I was still living in constant fear. And I also had to continue the visits and the adjustments 3 times a week, even after being seen for 2 years. Enter Dr. Blue. My husband didn't want me to have to go 3 times a week for the rest of my life, and he introduced me to Dr. Blue because Dr. Blue seemed to think that eventually I would not need to come in and be adjusted at all. The first 2 months, the migraines came back. The first 2 months under treatment with Dr. Blue, the migraines came back full force. And I had to trust him. But pretty quickly, I no longer had the migraines. And then as time has gone on, the constant aches and cricks are starting to go away. I was afraid, but Dr. Blue said for me just to live my normal life, and after having migraines for 30 years, I really didn't know what normal was. Now, I feel amazing. I'm living my life to its fullness, and I had given up on that. Pay attention to the word retracing. It refers to the ebb and flow of healing. There had been points where I got really frustrated because I would still hurt or still ache, but less and less as time went on. Again, Dr. Blue said to trust him. The comfort is in knowing that he perfects his craft, and that's present tense. He is always learning and always becoming more knowledgeable. He even showed me a chart that predicted how the ebb and flow would go in my healing, and he was right. It happened exactly that way. I have purposely, several times, not told him where pain was centered, and he was able to find it and relieve it. Dr. Blue has been professional, above bar, and gone the extra mile for me, and I consider knowing him a blessing.
All right. So how long has been the longest time, if you can recall, that you have held your correction?
I believe almost 3 months. I know at least 2 months that I've held without having to have any correction done, and that is amazing, especially coming from having to come three times a week. I mean, it's given me back my schedule, my time too.
And now, how often are you coming?
I come once every other week. I've even gone every third week, and it just depends on where I am in what I call that ebb and flow, the retracing, because that sometimes it allows me to not be seen for 3 weeks, and sometimes I have to come in just to be checked because something's out of sorts. But the visits are coming less and less.
All right. So overall, how would you express your feelings of upper cervical care and what it's been able to do for you?
I'm thankful. It has really changed my life. As I said before, I've gone to general practitioner chiropractors, and I know that their intentions are good and they know their craft, but upper cervical, because of the specialty of it and the specifics of it, I'm just amazed at the difference that it's made in my life.
All right. Thank you very much.